CI650.
Show me your teeth. Open your mouth, boy. Show me your teeth. Show me what you got. Show me your teeth.
I don't know. I've never had a woman come up to me and say, "Show me your teeth, boy," before, but I visited Dr. Ron Zokol, and anybody can ask me now. I'm proud to flash these pretty whites. Welcome back to BoomerLife on CL650. We're talking about your teeth, we're talking about your smile, and we're talking about solutions for dental problems such as missing teeth. Dr. Ron Zokol is our in-studio guest. You've been doing this for a long time, and we're so happy that you're here again today.
Yeah, me too.
Yeah, so you come from a dentist background.
I do.
Your dad was a dentist?
Yes.
Up north somewhere?
Originally in Kitimat.
Kitimat.
Actually, 10 years in Kitimat, from the mid-50s to the mid-60s.
And did you practice up there too?
No, I'm
Smart.
not that old.
Okay. What made you choose Vancouver? I know lots of people, of course.
Well,
but...
my father was from Vancouver originally, and his
okay.
intent was to always come back. So when he finished school in Portland, Oregon, actually, he was recruited to go up to Kitimat. He thought that was going to be a 2-year stint. It turned out to 10.
Wow.
And so I was 15 when we came down to the Vancouver area, and we've been here ever since.
Wow.
Yeah.
It's amazing. Just amazing. Before the break, we said we were going to talk about dental implants and how they've changed over the years, and I think they've changed dramatically since the days of Cleopatra. I hope they have.
Predated Cleopatra, interestingly enough.
No.
Yes.
What would they do back then?
They used ivory, they used shells like coral or something like that, that they would shape and pound into the area where a tooth came out of. It goes back to about 7,500 BC.
Did they have anesthetic back in those days, or just chewing the sleeve?
Probably not.
Probably not. No, geez, great.
Probably not. No, it's in fact we have some burial material where people have been buried, particularly emperors or very high class individuals or rulers or such, and they've got these coral implants in there replacing, in fact, lower teeth. And the evidence shows that they've actually functional in use because they had debris, food debris and various things like that caked on it, calcified onto these things, which indicated it wasn't put in after they died. It was put in at some time, and they lived with it and ate with it. Very interesting.
Must have been quite a painful operation.
I hesitate to think about it.
Me too. I don't. Let's go somewhere else. But people come to see you. It's not painful.
Well, that's the whole thing. Is we take a look at implant dentistry today, and none of it should be painful. I mean, just none of it. Be it bone grafting, implant placement, even the soft tissue work. This stuff does not have to be painful. And there are a lot of techniques we'll use to actually keep the discomfort down. And often we'll give people medications so that if they are in discomfort, that they will have some relief for bedtime, what have you. Most of our patients accumulate these things in their medicine cabinet and beg us not to give them any more next time they need a procedure done.
We were talking before the show, having a cup of coffee today in the green room, and I was asking you about some of your patients that come in at the big chickens, and you were saying sometimes the bigger the guy is, the more chicken he is.
Yeah, that's what
Really?
I found.
Yeah. And we won't say who they are and what they do, but they're out there.
Yeah. Actually, the people who control other people.
Oh, okay.
The people who use their size and are used to imposing themselves on other people do not like to be imposed upon. Of course, when you sit in a dental chair and allow somebody to come into your mouth, get in tight like that, and you don't have control, that's a very uncomfortable thing for a lot of people. So we got to be very considerate of that and help those people along a bit.
So those people in control in Victoria, then we should get them over and put them in your chair.
I wasn't thinking politicians.
I bet you were. The address, let me give the address again of BCPerio. That's where you're going to find Dr. Ron Zokol. He likes to hang out there and make people feel better and fix their smiles and fix their teeth. In Vancouver, it's 777 West Broadway. 501 is the number, 777 West Broadway. Please call for a consultation Monday morning if you can. Or I guess you could call now after the show and maybe just leave a message for you.
They could do that if they had to.
All right, in Vancouver, 604-872-0222, 604-872-0222. In the area of Coquitlam in the Tri-Cities, it's number 250, 1175 Johnson Street, 1175 Johnson Street in Coquitlam, 604-936-8244, 604-936-8244. Dr. Ron Zokol, you say you have a few more females that come in to see you than men. Do they have different problems?
always.
Really?
Yeah, it really varies. A lot of women are more concerned about not only how they look, but their health as
Mm-hmm.
well. And not that men aren't concerned, but they are distracted so often by their jobs and responsibilities. And that's my suspicion. That's my take on it. And only when it gets to be a little worse than it needs to be do they
Mm-hmm.
actually show up and start doing something about it. And therefore, their work is probably a little bit more challenging because the disease process has gone on a little bit longer. But by and large, women are more, I hate to say responsible, but it
Yeah, you
might
can
look
say
that
it.
way.
It's okay. No, it makes perfect sense. That's why we all have moms.
I suppose that's true.
Remember saying to your mom years ago, "Mom, where are my socks?" And she'd say, "If I have to come down there and find them, they're right where you left them. Oh, on the floor." Floor. And you know what? If you go down to BCPerio, there's nothing on the floor except carpet.
Yeah.
Yeah, we
Yeah,
take
tile,
care of that.
yeah.
Tiles, carpets.
Yeah.
They've got some great coffee. They've got a great view. They've got a wonderful facility. Tell us a little bit about your facility.
Well, the facility is ultra modern,
Mm-hmm.
and the beauty of this is that we have the technology to manage probably the most complicated of all problems. If you don't have the resources to treat, I'm talking about laser technology. I'm talking about X-ray systems that allow you to take three-dimensional visions of the bone and jaw structure, that allow you to diagnose at a higher level, to treat at a higher level. All this stuff plays to the ability to efficiently and effectively solve issues and create long-term stable results. So we're kind of blessed at BCPerio that we have all of these things very much right in front of us and all the tools to trade there, so we're not limited by technology problems.
I know that you're always getting new ideas and new ways of doing things and new technology down at BCPerio. You're always getting new pieces of equipment. What is the most recent piece of equipment you got into your clinic that you're most excited about?
I would think that we have maybe the iCat Flex, which allows us to take the three-dimensional X-rays that we have at very, very, very low radiation dosages.
In fact, it's less than a regular.
It's about the same as a regular small
Wow.
little X-ray that many dentists will take 4 or 12 of
Mm-hmm.
every time you come in, and this allows us to see much more than any other X-ray system whatsoever. And the beauty of it is that we don't charge for this X-ray.
You don't?
It's normally about a
Wow.
$350, $375 procedure, and we have made that choice that it is such an important part of the diagnostic process to understand comprehensively what is the problems might be,
Mm-hmm.
and we do not want to have questions still in our mind as to just because somebody can't pay for an X-ray. So what we do is we help everybody understand everything that's going on in their mouth as much as we possibly can. This instrument is very, very helpful for it.
Wow. Yeah.
The other things are lasers. We have 7 different lasers, different wavelength lasers. Now each laser has a wavelength that treats different tissues slightly differently, and the combination can be incredibly effective. As a matter of fact, we held a course just past week actually for doctors that came up from the U.S. and various parts of Canada to be trained in laser technology, and we were doing that just last weekend.
I think the great thing too is somebody goes down to see Dr. Ron Zokel. You're not getting just a run-of-the-mill dentist. No, sirree, Bob. You're getting an expert in his field. You also train, like you just said, train other dentists to do it. So if you can train other dentists, then I can trust you with my mouth. Right?
I think that's probably one of the reasons I do get the international patients.
Well, I don't know. I mean, our producer of the show, Dwayne, came to see you, and he's all in
Yeah.
one piece now, and he's happy, and he's smiling, and got some beautiful teeth. So it's BCPerio Dental Health and Implant Center. The gentleman's name on the radio, you hear him all the time. He's been in Vancouver for many, many years, making people happy and healthy. His name is Dr. Ron Zokel. And if you'd like to get a hold of Dr. Zokel, in Vancouver, it's 501-777 West Broadway. That's 501-777 West Broadway at Willow. And I suggest you pick up the telephone and say, Dr. Ron Zokel, I heard you on the radio on CL650. I want you to look into my mouth. And I'm going to come down and see you Monday if I can do so. So what you got to call up first to make an appointment, 604-872-0222, 604-872-0222. In Coquitlam, it's number 250, 1175 Johnson Street, number 250, 1175 Johnson Street, Coquitlam, 604-936-8244, 604-936-8244. And you're listening to Boomer Life on CIL 650 with Dr. Ron Zokel and Tom Lucas, and we'll have more for you right after this.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on CIL 650.